Mm.
Yes.
It's time for First Day with Kelly Kinkaid. That's an interesting clip. Kelly, welcome back.
Good morning, Sway. Good morning, citizens. How are you? October, we are in Breast Cancer Awareness Month, and we had to bring this to Sway in the Morning to talk about it. And, the clip said it is unacceptable. And we're talking about women of color, and also men. So this affects and touches everyone who's listening. And today I have a guest, Nurse Noel, and we call her affectionately Nurse Noel. You may have seen her on Dr. Oz. She's a resident nurse, and you talk about a lot of things. But this month, you're talking about breast cancer. You also are one of the ambassadors for the Know Your Girls with the Ad Council and the Susan G. Komen. Welcome to the show, Nurse Noel.
Thank you. Thank you for having me.
Nurse Noel, good to have you on. Where's
you.
Dr. Oz? Is he here too with you?
No.
Oh, okay.
They're taping.
They're taping right now?
Yes.
Well, welcome to the show. So you said men, Kelly. You brought up men.
Actually, yeah, because the actor Richard Roundtree had breast cancer, and how do men get breast cancer? Because with breast cancer, you always think of women. We have, pink. We see a lot of people, even on the planes. Delta Airlines celebrates and makes breast cancer awareness, really popular. How is it affecting? It's a small percentage with men, but how is it affecting men as well?
So 250,000 women are diagnosed every year.
Right.
And 2,500 men are diagnosed every year, and 500 men die from breast cancer every year.
Wow.
And
Can you repeat those numbers? You said how many women?
250,000 women are diagnosed
With breast cancer, every year. And how many men?
2,500.
2,500. Okay. And
it's breast tissue, so it's a malignancy in the breast tissue itself. So it can affect anyone because men have breast tissue too.
Right, and it starts with when girls start having their menstrual cycle.
Yes.
But with men, when do they have to start checking their breasts because it is breast tissue?
Well, men when they go through puberty, because they do have estrogen, small amounts of estrogen in their bodies, and a lot of people don't know that. So, know your normal. It's about knowing what's normal for you, and looking and feeling.
Because for women, it's after your cycle, you do the 2-finger test going around. You can explain it.
So the Susan G. Komen Foundation, we actually changed the guidelines because what women were getting intimidated. They didn't want to do it. They're like it's like a test. So they say you have to take 2 fingers and you palpate in a circular motion around your breast tissue to the center.
Looking for lumps.
Or indentations, any like bulges, anything that's not normal for you. So know you're normal.
I'm sorry. And men, they would examine it in a similar way.
The same way.
And you say through puberty, because of the releases of estrogen, we're liable to have we're susceptible to breast cancer as well.
Yes.
What are some of the youngest ages that you know of men who were diagnosed with breast cancer?
I knew someone. Well, about 12.
12 years old?
12 years old, yeah.
So, Nurse Noel, if girls are checking after their menstrual cycles, when do guys check it? Is this a monthly thing or when they just touching their chest?
You check a few times a month, every other month, but you have to do it like systematically because it can change. It can vary from month to month. 1 month you can be, can be normal, and then the next month, 2 months later, you can find a lump.
Can we use Sway as like a demonstrator to make sure that he's not simply just caressing himself?
What do you want?
Versus checking.
You want me to do it?
Yeah.
Can I do it with my shirt on?
Yeah, sure.
Okay, so I can take it off. You want to get these views popping? Yeah, I mean. So how would I do? I've never done this. So what would I do?
So you take 2 fingers. You take the balls of your fingers and you start from here, and then you a circle motion.
A circle motion, like.
And then you go around.
What am I looking for?
You're looking for a lump. You're looking for anything that feels.
I certainly hope I don't find one.
Anything that feels abnormal, indentation. Sometimes
Should I flex while I do this? Or?
No.
Okay.
Please don't.
Okay.
No.
Okay. You sure?
So, Nurse Noel, I'm sure you've also heard of a term called moobs. For men, when they have a lot of extra fat in their chest area, and it makes them appear as if they need a bra. If you do have moobs, does that mean you're at higher risk?
That's called gynomasty.
Yes.
And
Tracy, what is it called? Gyno?
gynomasty.
Okay.
That's why we have the nurse here.
And it's just because you have more estrogen in your body.
Right.
And it doesn't mean that you're more susceptible. It just means that you have more breast tissue and more fat.
And it's been reported that African American women, their rates are escalating.
Yes.
And I want to talk about factors with women. So we know that when you start your cycle for girls and for boys, puberty, what are the factors and risk factors for these women, and why are African American women's rates escalating for breast cancer?
Family history. That's number one. So a lot of people don't talk about their health. People don't know why their grandmother died, why their great grandmother died. In our community, we don't talk about our health. Yeah. It's very, very quiet. It's very, I don't even know why my grandmother died. My mother doesn't know. So it wasn't talked about. She just, as a nurse, now we can deduct, because my mother's a nurse too, that she died of ovarian cancer. And we didn't know because it wasn't talked about. So family history is number one. Obesity, weight, alcohol, smoking, and
stress?
Well, not stress, no.
Okay.
Not stress. More of your diet. So meat, a lot of carcinogens in meat and processed meat have nitrates in it. So you would want to stay away from that.
And women over 40. It's been always known when you're over 40, you should start getting your mammograms. But because of family history, women who've had breast cancer in their family history should do it earlier, correct?
Much earlier, yes. And also if you feel something, I felt something. I mean, I'm going to be honest. I felt a lump when I was 32 years old. And I immediately went to get a mammogram. And, insurances sometimes don't want to pay, but they will, you can waive that, because if you find an abnormality, they will definitely do a mammogram for you.
Nurse Noel is here. We're talking about Breast Cancer Awareness Month, which is the month of October. We got Devin on the line from Charlotte. Good morning, Devin.
Hey.
Good morning, Sway.
How you doing?
Good morning.
I'm doing well.
I'm glad you called, Devin. I didn't know how many men would call during this segment, but this is really interesting when we're finding out about breast cancer, how it affects us all, right?
Yeah, so I guess let me go ahead and start with my story. I guess 16, I was running track, and just one day, I guess I was laying down. I just felt this lump in my chest. Luckily, I had physical coming up, so I went to my physical. A little embarrassed to say anything about it because I'm a guy, and I thought that it was just not normal. So I kind of played it off like, oh, I feel a lump in my chest as I was leaving my physical, and my doctor kind of felt it and was like, oh, this is normal. This is, and she told me what it was, but I can't remember at the time, at this very moment. But it's good to always kind of check up on your health and all, because it could have been something worse.
Could have been something worse. Yeah. Yeah,
it could have been breast cancer. So it's always good to actually check.
Man, thank you for sharing that story, Devin.
I love how all the men in here now are touching their chest, trying to see if they have lumps. And
that's what you're doing, Ty? Okay.
Yeah.
I think he works out. I thought he just likes the way he feels. The stigma with illness in our community, too, I think is what kind of keeps us from discussing if we're sick or not. Being sick is being often seen as a sign of weakness.
Yeah,
you know what I mean?
Exactly.
So we don't, man, I got family members now to this day who go to the doctor. We have no idea in 2018 what's going on with them. You don't find out till it's usually too late.
Right.
You know what I mean? I want to open up the phone lines. It's starting to light up. It's Breast Cancer Awareness Month. We have Nurse Noel is here. Any questions you have? Maybe you have family members that are dealing with this, or maybe yourself. 888-742-3345. Give us a call.
Month, Know Your Girls, which is sponsored by the Ad Council and Susan G. Komen Foundation. October is Breast Cancer Awareness Month, and know your girls. And we've been talking about examinations as far as early detection is very important, but not only for women, but for men as well. And I wanted to speak with, and we just had Devin call us about him finding a lump, and clearly he's here, so he had early detection. Right. But for all those hypochondriacs out there who feel lumps, if you go get yourselves checked, because it may not be breast cancer, it may not be cancer.
It could just be, a nodule, or, it doesn't have to be. When I found my lump, I went to get a mammogram, I got a biopsy, and it wasn't cancer. It wasn't malignant. So it doesn't mean cancer. It's not a death sentence. It just means that there's an indication that you go get tested.
It's so important to have people as like yourself up here, because we want to advocate early detection. Know your body, know your girls, know your body. You are your first doctor, but we have professionals like yourself that are here that'll help us, and it's nothing to be afraid of. We want you here longer. That's why we do this segment.
Exactly.
Joe's on the line from Michigan. Good morning, Joe.
Good morning.
How you doing?
Doing okay, man. You have a question for Nurse Noel?
Well, first, I'd just like to tell her thank you for opening my eyes to the man side of it. I never knew that we could get breast cancer. And my question is like, if a woman has implants, can they still check themselves like you're describing?
Oh, thoroughly, right?
Yes, you can, because it depends on whether they go under the muscle or over the muscle. But women who have implants still get mammograms. And they tell you, if you have implants, get mammograms earlier.
Okay, but do you have to touch yourself differently?
You won't be able to feel it. Because
you just have to schedule it.
You have to get a mammogram.
Okay.
Hey, Joe, great question. Thank you, man. Melissa from New Hampshire is on the line. Go ahead, Melissa.
Good morning.
Hey, Mel.
Hi, I just wanted to say I'm glad to hear somebody talking about men getting it. When I was growing up, my mom's uncle had breast cancer. I knew about it, but as Nurse Nicole pointed out, we don't always talk about health problems in the family.
Yeah.
Through the power of Facebook, come to find out that BRCA2 runs in our family, and the geneticist that I spoke to said that primarily one of the reasons men get breast cancer is because they are a BRCA2 carrier.
Okay, so the BRCA1, BRCA2 gene mutation is. So we all have these genes in our body. We call the BRCA1, BRCA2 genes, and what they do is they prevent breast cancer. So once there's a mutation, something's wrong with those genes, then we are more likely to get breast cancer. And a lot of people like Christina Applegate, Angelina Jolie, they tested positive for that gene, and that's why they got mastectomies.
Right.
Not because they had breast cancer, but because they were more likely to develop.
How does a man, what is it called, mastectomy?
Mastectomy.
How does that, if a man detects breast cancer or diagnosed with breast cancer, the same procedure happens for him?
They get lumpectomies. You can take breast tissue off. So mastectomy is just taking breast tissue
Okay.
off. Yes.
That's all it is, but that's not removing the actual.
They remove everything. Yeah, and sometimes the lymph nodes also.
Okay, educate me, Nurse Noel. I didn't pay for that education. All right, we have TJ on the line from Chicago. Go ahead, TJ.
Hey, T.
Yeah. Hey, how y'all doing this morning?
Doing okay, TJ. What's going on with you?
Yeah, I was in high school on a football team, and you always playing around in the locker room, and I always felt like a little lump inside of my right nipple, so I didn't think nothing of it. And one time, one of my teammates was like, "Why you got this titty on you?" So he just grabbed me, and when he grabbed me, it's like some fluid came out, like it squirted. So I was like, that was abnormal. Everybody was like, "Whoa, what the fuck was that?"
Word.
So I was embarrassed, So then, like after that, I went straight to the hospital the next day. I didn't even go to school, and the doctor just scheduled me for surgery. He didn't even say anything about breast cancer. He just scheduled me for surgery, and they took out the tissue. So,
wow, you've been okay since? You've been okay since?
Yeah, I've been all right. Ever since the tissue get removed, I haven't then after that I had like little drainage. I didn't know if it was like from that, but it was just weird to me. I didn't even know about men having breast cancer. You always hear about women having breast cancer.
Yeah,
but as far as men, that was kind of weird.
And he was so young, right?
Yeah, so nipple discharge is also a sign. So nipple discharge, lumps, any indentations, anything that looks different. One, but some people have one breast is larger than the other normally. But if it changes, that's what we're looking for.
What's your social media if people want to reach out to you?
Nurse Noel _
Nurse Noel _ This has been really informative. I hate that they only do. Why do we even make months? This should be like awareness every day, right?
It's 365.
365,
Yeah,
right?
I think the Susan G. Komen is one of the biggest foundations because they have the walk every year and they do stuff throughout the year. But for October, it's a really big focus. But you're absolutely right. We need to focus on that and I always say, know your body. Early detection is the best thing, and we want to thank you for coming.
Oh, thank you for having me.
Yes.
Yeah, it was great.
Yeah,
thank you.
Thank you so much.
Nurse _
No, Nurse Noel, NOEL _
Nurse Noel _ You guys follow her. Mention you heard her on the show. She'll respond to you. I know when she gets time.
No,
You'll respond to him
all the time.
Okay, thank you.
And I wanted all the citizens listening out there, if you know someone, a female and even a male, check your friends, check your family, make sure they're checking their body and making sure that they're doing their monthly examinations. It's important.
You can reach Kelly Kinkaid directly
At Kelly Kinkaid, KELLYKINKAID.
All right. Thank you, guys. Up next, we have T-Pain. T-Pain has a new business venture. Citizens, we're going to let you interview him. If you want to talk with T-Pain, 888-742-3345.